Nutrition made the headlines this week with claims from the National Obesity Forum saying that by increasing fat consumption, cutting out carbohydrates, and avoiding snacking, obesity and type 2 diabetes can be reversed. Excellent. More advice, more contradictions. Are you confused? I'm confused. Since this publication has been released, there has been much debate and criticism surrounding the report. And the report itself is broken down into several sections and looked at some key sort of headlines, such as eating fat doesn't make you fat, saturated fat does not cause heart disease, and full-fat dairy is probably protective in some way. Processed labelled foods such as low-fat foods, light versions of foods, foods that are deemed as being low in cholesterol, proven to lower cholesterol, they should all be avoided. Starchy and refined carbohydrates should be limited to prevent and reverse type 2 diabetes. Optimum sugar consumption for health is 0. Industrial vegetable oils should be avoided. People should stop counting calories. You can't outrun a bad diet. And snacking will make you fat. Evidence-based nutrition should be incorporated into education curricula for all health professionals. Interesting. So this report addressed sort of all of those various points. But the main thing I think that has been so controversial is that it's not a peer-reviewed paper that has sort of brought around these findings. The report itself is sort of a narrative. It's written in sort of like an essay style, pulling out various sort of references as it goes along, which has sort of sent health professionals into a bit of a uproar. Most scientific studies will be peer-reviewed if there are claims around new evidence, and that basically means that a body of other health professionals will look at a study that comes out and are given the chance to critique it and review it before it's formally published, which wasn't the case for this report. As a dietitian, I think there are elements of this article that are very unhelpful. There's so much nutrition advice out there already, and this publication is simply adding to the confusion for the public. There is limited evidence around carbohydrate elimination for those with diabetes, and by cutting out food groups, as suggested in this article, this could lead to nutrient deficiencies within the population and have adverse effects on blood sugar control, especially with those individuals who might be taking medications such as insulin based upon their carbohydrate consumption. For more information about diabetes and the guidelines on healthy eating, make sure you check out the various videos and information on our website. There are so many excellent articles about this debate, which I will post at the bottom of this video, so make sure that you check them out for more information.